This is the Psychcast by MD Edge, where we bring you interviews with leaders in the fields of psychiatry and psychology, masterclass lectures, and inspiration, with new episodes dropping each Wednesday. I'm the voice of MD Edge Podcasts, Nick Andrews. And welcome to episode 129 of the Psychcast by MD Edge. I am Nick Andrews, and as a tropical storm makes its way up the eastern seaboard, Dr. Lorenzo Norris will not be joining me this week to introduce this episode. Our guest this week is Dr. Derek M. Griffith, who is a PhD at Vanderbilt and an academician. He's going to join Dr. Norris in just a little bit to discuss the different ways that men's health is being impacted within COVID. You can read articles written by Dr. Griffith and other work by him by clicking links in the show notes. And don't miss, after our interview, Dr. Renee Kohanski is back with the Dr. RK segment. She has a message this week about hope. This episode is complete with robust show notes authored by Dr. Jacqueline Posada. The confluence of COVID-19 pandemic, the death of civil rights leader John Lewis, and the death of Herman Cain from COVID-19 requires us to reflect on race, gender, personal identity, and our own vulnerability. That will be the topic of today's episode. You can read the notes wherever notes are found in your app. Don't forget, you can email the show if you have topic ideas or suggestions at podcasts@mdedge.com. You can reach out and connect with us via Twitter at mdedgepsych. Okay, without any further ado, please welcome the host of the show, Dr. Lorenzo Norris.
This is Dr. Lorenzo Norris, Editor-in-Chief of MD Edge Psychiatry. Today, we are really privileged to have Dr. Griffith here to speak with us in regards to different ways that we can look at, if you will, a number of topics, including race, men's health, and a number of things. And I'm just so pleased that we have Dr. Griffith on the Psychcast today. We have actually, this is, I want to say, the first time that we've had it really feels like a very cross-disciplinary field. And we have those social sciences, which I personally strongly believe, if we're going to really affect healthcare in this country, we need to be talking more with folks like Dr. Griffith and getting his perspective from things. So, Dr. Griffith, I want to thank you so much for coming on the Psychcast.
Thank you for having me.
All right, so Dr. Griffith, yesterday was, in my humble opinion, a very unique day in human history. Now, any day is unique depending on one's vantage point. But yesterday we had, if you will, the funeral of Congressman Lewis, Mr. John Lewis, a luminary in the field of civil rights and a leader. We had 3 presidents speaking at that funeral, and I would encourage people who have not heard that to listen to it. Very powerful. We had the death of Mr. Herman Cain, a former presidential candidate, CEO of Godfather's Pizza at one point in time, and someone who was absolutely, I would say, definitely well known in America. In addition to that, we are still dealing with, if you will, not still, a raging pandemic, an economic crisis, and so many questions on race, social justice that to name a few, that it boggles the mind. So, Dr. Griffith, I wanted to get your perspective. I mean, and maybe we can start with, I guess, Mr. Cain's passing. And first off, my condolences to Mr. Cain and his family, as well as all of those who, of all race and ethnicities, who have lost family members and loved ones and friends to this disease, this virus, SARS-CoV-2, if you will, that causes COVID. At last count, I believe we were at 152,000 deaths. That was yesterday, and I'm sure that number will continue to go up. But my thoughts and condolences to Mr. Cain and his family, and I hope that they have a sense of peace. What I can share with the audience is that when I heard of Mr. Cain's death, it activated something in me. I don't know what that is. I felt a great deal of emotions and thoughts, and I couldn't actually figure out what all I was thinking. I knew I wanted to touch upon it or speak about it, but I didn't want to just jump to any one conclusion. I just knew that it affected me. So I talked to my editors, and they said, you know what, maybe we can get some other people on board to have another look or a lens at this. And so with that being said, Dr. Griffith, as we can touch base on the other elements, but as we start with Mr. Cain and his passing due to coronavirus, what are things that you think about from your lens and your wheelhouse, sir?
Yeah, I mean, it's, I think the first thing that comes to mind is reflecting even just on what you just said, and your reaction. A lot of times events resonate with us in a particular way because we identify with that person in some way. And sometimes it's not obvious what that is. There could be many reasons that people may connect with him and see something in him, and that may resonate and sort of trigger something in you. And we know that actually those can be actually things that are used for good. So a lot of times, one of the best things that can happen to get people to make changes is when they see something, unfortunately, a tragic event in somebody's life, or something happens to someone that they somehow or another see themselves in, and it triggers something like, oh, that could be me. So I think those kind of things, are really important as a starting point. Is we want to, again, honor Mr. Cain and all the success that he had and so forth. And again, I also want to offer my condolences to his family and loved ones and so forth. And I know a lot of folks may have different opinions, perspectives, and so forth about, his political viewpoints and so forth. And that's beyond the scope of what we wanted to get into.
Mm-hmm.
But what I do want to say, it is striking to me just thinking about COVID. This man was a stage 4 colon cancer survivor. I may have been, I want to say it may have also been lung cancer. I mean, he had at least, stage 4 cancer that he survived. He managed to survive that, raged back in recovery, was amazingly well. And then, dies of this, very, this virus that we're so struggling with. Yes. Like you're saying, in the midst of this perfect storm of all this other chaos that's in our lives. Mm-hmm. And so, it's hard to sort of disentangle, both what sort of resonates as well as the sources of stress that may affect us in different ways. So one of the things we know about, just in the list of what you described sort of in your opening, with the death of John Lewis, he definitely is somebody, both for me as a Black man, as a man of faith and so forth, I very much identified with and so forth. The pandemic and just the level of stress and constant sort of worry that has for people. And then again, the looming economic crisis and so forth. I mean, all of these things, it's kind of difficult to just point to one thing and say, okay, that's what's stressing me out. Yes. It doesn't need to be the one thing that's really bothering you. It just is something about that whole experience. So I think that kind of thing, we don't want to simplify these kind of issues when it comes to Black men, Black men's health, or health in general, or, even risk factors for COVID, because there's so many other factors that are playing a part that we want to acknowledge and really recognize and bring to the fore here.
I would agree with you so much in just hearing you talk, Dr. Griffith. And I think that as I reflect and as I was thinking about this, we want to make sure that we are thinking about this and we're not necessarily pointing in this particular element or that particular element when a person has passed. We want to really, and again, I think about what did Mr. Cain's passing as well as others passing, how did that affect me and what might other people be feeling? And you said something very important in terms of Mr. Cain, and sometimes there being some similarities. I think one thing that strikes me with Mr. Cain is many ways. He was a survivor. Very strong man. All right, that most people would say, and also, if you will, a bit of a kind of the prototypical American, success story. And I would be, from my standpoint, again, regardless of your race or ethnicity, I think that at times it probably made me think about being vulnerable. It made me think that, examining some of the things in my mind, that even though I'm a physician and I am working with COVID patients and I have PPE and things of that nature, I know that what I'm saying is I know there's a risk, but even in the back of my head, it's probably still like, well, it's probably not going to affect me. Or even if I get it, it's going to be less than what I anticipated. Not anticipated, but I'm going to be okay. And when I thought about Mr. Cain, as well as others that have passed at this point in time, as some listeners of the podcast will know, I have lost family members to COVID. But it just made me reflect on just the nature of this virus, what it caused, how it can affect any of us at any point in time. And more importantly, it made me question, if you will, my own thoughts of either being invulnerable or I am not going to be affected by this. And so it started to bring out those type of thoughts. But please, Dr. Griffith, how do you?
Yeah, I mean, I think, it's easy to just say, okay, you're a black man, I'm a black man. Cain was a black man. So it's this sort of black man identity thing that we're connecting around. And that, for some people that may be the case and some people it's not. But I think the idea that, for various reasons, people are saying, they'll look at the situation just like anything else and say, well, yeah, this is definitely out there as a risk, but it's not going to be me. Mm-hmm. And that's a common sort of trope that we apply to masculinity and to men in general, about why men don't do things like go to the doctor and take care of themselves and so forth. That one of the other things that gets interesting that we would also share between, myself, Dr. Norris, and Herman Cain is, even affluence and success professionally does not necessarily protect us from developing a lot of the things that are more likely to kill us. So that we tend to, even with economic and educational success, have lower, rates of life expectancy. We know that, we're still succumbing to rates of premature mortality that are far above, our gender peers or race and ethnic peers. So it's not as simple as just saying, okay, well, check one box for race, check another box for gender, and that's why we're connecting. I mean, there's something about sort of the way that these things happen that we have to pay attention to.
I would agree with you. And as I think, I'd agree. And it's not as simple as you just said, it's not a simple gender or black male thing. It's what we might be connecting with. And one of the things that I started to think about as we've been talking, or as I was reflecting, and maybe listeners can hear this and maybe not, is these are tough topics. These are complex topics. But one of the things I thought about personally, I want to be clear with everyone listening. I'm talking about my thoughts personally, not as they reflect on anybody else, but my thoughts personally is this air, if you will, for myself at times of a little bit of invulnerability, a little bit of, and I think that can be a useful thing, but maybe even a bit of that American spirit that, if I think about it, I'm holding myself to task. Like, in January, how serious was I really about coronavirus? As a medical professional, how really, was I calling it coronavirus or was I calling it SARS-CoV-2, which is probably because that's a severe acute respiratory syndrome that has a different connotation to it. Was I actually really, has my culture and how I view things allowed me to underestimate things or its ability to affect our society and our culture? Because I never would have thought that we would be in this place, even though when you look across the world, they were there. But as I think about it in my mind, I just had these ideas that, well, we're America. And, we're just going to handle it. And I mean, that's not, I want to say, I think that's just apolitical. I just think we, in a certain way, I mean, you can pick many people who've been like that, whether it is someone such as Congressman John Lewis, whether it is RFK, whether it is, take your pick of whichever American in politics, business or whatnot, who has, as obviously as also as well as women, RBG, Ruth Bader Ginsburg, take your pick. But I felt like I have this spirit of like, oh, we're going to be fine. It's not going to affect us like this. And even you could hear that in regards to, I can't speak for other medical professionals, but I was kind of like, oh, well, maybe the summer. I mean, I wanted to embrace that, but it's just that, and I think about that culture, which I think is a good thing in terms of Americans that, we can do anything, but at a certain time, that can become a very problematic thing. And it's made me reflect on my own views or how I am a part of that. So please go ahead, Dr. Griffith.
No, I think you're right on. I mean, it's funny you're mentioning January. You're giving yourself a lot more credit. I mean, I remember going to a meeting in March, early March, and the worst that we thought was, okay, just don't shake hands with people.
Yeah,
still sitting, literally chair to chair, next to each other, having conversations up front. There definitely was no such thing as wearing masks or worrying about sitting next to people or whatever. And, but it's important to sort of to be open to your information and your understanding of different things growing as new information comes out. I mean, I think part of it is the information that we had was so limited, and is, part of the title, is this a novel virus? This is something that we haven't seen before. We've made certain assumptions. Oh, it's like this. Oh, it's like that. And some of those assumptions have worked out and been true, and many of them have been false about, how controllable or easy this is. Oh, we're going to have herd immunity. And so, by the summer, it should be fine. Everybody was starting making plans, to go on vacation and real vacations during the summer. And, it's just not happening. And so I think it's all of those things about, like you're saying, and, that being able to sort of work with information and being able to accept it as it becomes new, but really take that into and into your being and take that seriously. I mean, I think the other thing that sort of comes to mind for me is, the parallels between sort of personal preference, individual agency, and those kind of things that are very much hallmarks of, an American sort of ethos. Are also very much, things that we celebrate in some ways, but also demonize men for. So, men are, there's always the jokes about men not asking for directions, asking for help and all that kind of stuff. And on the one level, we also have to recognize that we also encourage men to be that way. That we expect men to honestly be that way. We don't want men usually to be ones who are hanging on to others. Who we want men to be strong and be independent, to be able to handle things when they come up. It's just that when you apply that skill set or that idea to something like your health, then that's where this becomes problematic, is because you don't have the information and the skills to be able to make those kind of decisions, because you're not a darn doctor. And even if you are a doctor, you're not a doctor who can treat yourself. So those are the kinds of things that we have to kind of pay attention to. Even if you have information, you have to realize that information continues to evolve. Even if you have expertise, you can't look at yourself usually with the same objectivity that somebody who's a professional can, and help you make decisions about things like your health. So all of these things we have to take into account and put together in this picture when we're trying to take care of ourselves, particularly in a moment like this, where there's nothing but, essentially chaos around us, whether it's from an economic, political, social, and not to mention just the obvious elephant in the room, the health perspective. So we've got to be mindful of that and really, really try to take advantage of this moment where we're actually a little more humble and honest with ourselves. Like, okay, I don't know everything, so let me make sure I'm looking to get and keep up with the most up-to-date information.
Dr. Griffith, that was, you just put so much in my head right now, so much in my head. And I think about when you talk about ideas of men, masculinity, men's health. I mean, I don't, I'm using it a specific way. I start to think about, for lack of a better word, I'll borrow a term from cognitive behavioral psychotherapy, like schemas, ideas we have, and that sense of autonomy. And I'm not limiting this to just men, multiple listeners of the audience. I'm just going with that because of what we're talking about in terms of men's health in particular. But that idea of pushing forward, that taking what's there and making the best out of it and being able to navigate anything. But you brought up something that's so important. The lack of information or ever-changing information in the sense, in the setting of just chaos and constantly evolving situation. And then I think what you said, are we actually able to take a step back? Particularly, I'll speak for myself or whatnot. Can you take a step back and say, wait a minute, I actually don't know everything that's going on, okay? And not only do I not know what's going on, because there's so much going on, trying to interpret even the information that's out there is going to be difficult. So how do I actually slow down? And now I'm thinking about it. How do I slow down and not be so independent, but be more networked with my fellow humans and trying to figure out what actually makes sense based off of limited knowledge, because it goes back to what you said in this moment. You could pick any one particular element, and that in and of itself was a crisis. And as I mentioned on previous sitecasts, there were many epidemics before the pandemic. There was a suicide epidemic. There was an opiate epidemic. There were many things that were taxing. In coronavirus, not only does it take lives through its effect on the respiratory system, as I like to think about it, it unveils, it reveals cracks that were already present, particularly, if you will, if there are social disparities or social inequities in regards to healthcare. And we are definitely seeing that, certainly in certain communities, particularly communities of color. And I know that one of your wheelhouses is social disparities and social health inequities. And I was wondering if you could comment a bit about that, Dr. Griffith.
Yeah, so I think you're hitting on it. I don't know that I have a whole lot more to articulate other than what you kind of described. Is this really? We just wrote a piece for a blog on a gender and COVID website that is managed by a group that's a global group that's actually run by a group at Johns Hopkins.
Okay.
And it was basically the COVID elephant and the men of race, gender, and place. And part of it was this idea that, if you look at COVID just through the lens of race, yes, you get a particular important perspective on it, but you may be missing, place factor into that. And how does the fact that men are dying at twice the rate of COVID than women, how do those kind of factors also play into it? But then you get the same problem if I look at it just through the lens of place and you're missing gender, and you're missing, and if I look at it through the lens of gender, then I'm missing, and then, those are just three.
Yeah.
As I talked about this on something else yesterday, there are other things that come up or that are particularly important as a perspective and as a particular dimension that we don't have data sources that look at, whether it's sexual identity and orientation, whether it's, rural, urban. There are other kinds of factors that play a part in who's at risk and who's likely to die. We know age has been a huge thing, and we've kind of, that's let some people, let down their guard, unfortunately, to their peril, because, now that we're, as an academic, as I prepare for, school in the fall, and we're still in some version trying to do something in person, it's like, well, how are, obviously a lot of the concerns about the conversations that we're having is what does this mean for our undergraduate students, and how are they going to manage that and so forth? Are they going to follow, guidance, recommendations, and so forth? And we can look to young people as sort of like, well, they don't follow rules and so forth anyway. But they're no different than, adults who are supposed to be, who we know are at higher risk, who are also saying, none of this stuff matters.
Yeah.
I'm at risk anyway. So it's not, you can't just blame it on age. So my opinion is any singular lens is limited when you're talking about such a complex issue. And you've got to try to pull together as many different perspectives and ways of looking at the problem to be able to have the most effective solution. We can't just sort of limit it through the lens of, it's about access to testing. That is going to be an essential part of it, but that's not the only thing. We've got to also look at, the wearing mask has been, politicized as a huge issue and so forth. But that, again, in and of itself, that only matters if you're encountering people who are actually at risk. It's funny to me to watch people driving around who are in cars by themselves with a mask on, and I'm just. I really appreciate your commitment to health and so forth. You're going stronger than I am, but I'm also like, okay, maybe you're not completely understanding how this mask thing really works. So it's just fascinating, to think through it through these particular lenses. So
yeah, Dr. Griffith, I really want people to read the transcript of this because you just laid out what one of my colleagues in the Group for Advancement of Psychiatry, Dr. Jack Drescher, talked about when we were talking with our media committee on COVID, and the term he was talking about is, how do we manage complexity? And so, audience, listen, Dr. Griffith is laying out complexity. You cannot, in other words, when I think about that, you cannot examine one thing in isolation to the exclusion of everything else, because it's not going to actually make sense. I mean, when I think about that, I think about, and I'm awful at math, but I remember, I want to say it was like matrix algebra. Like, you change one thing and then everything else changes or whatever. Very powerful if you know how to use it and things of that nature. I mean, so maybe we need to get a mathematician on here next. But when you talk about that, Dr. Griffith, and using the mask example, as well as the age example, I mean, because I think if people are being honest, I mean, I've seen just as many young people, and guess what? When I take my walks, when I leave here, I take my walks. I've seen just as many people in my age cohort, 40 plus, without a mask. I mean, they may not be hanging out at a bar or whatever, but that need to interact. So, I mean, you can't just simplify it and reduce it. And I think that as we move forward, I mean, that's a potential advantage if we use it of this forced isolation, and it's to slow down and actually think about how these complex factors interact, because they've always been interacting. It's just COVID is bringing about in a different way, and that's in complex things are typically hard to solve until people like yourselves or others kind of simplify them, and then you figure it out. Dr. Griffith, if you had to pick this, I know I'm putting you a little bit on the spot here, but one of our dear departed members of our clinical psychiatry news editorial board, Carl Bell, preeminent child and adolescent psychiatrist. Okay, you're not here. Maybe you know Dr. Bell. I do.
All right, so that's I actually had the pleasure of meeting him years ago. I lived in Chicago, went to graduate school in Chicago. So I had the pleasure of meeting him years ago, and huge fan. So yeah. Well,
I'm very happy that I heard that. I am very in these kind of tough, dark days, I'm very happy to hear that, because I didn't interact with Dr. Bell as much as others, but I definitely considered him a mentor. And Dr. Bell coined this phrase in terms of how we think about things. We ask hard questions. And anybody who's met Dr. Carl Bell will like, he asked some hard questions. I'd be like, man, Carl, dude, I can't answer that. He's like, that's why I asked it. Mm-hmm. So let me start to ask maybe a few tougher questions. If you had to pick something, any one thing that all of us are missing in the general conversation about COVID, what would it be?
That we think we know more than we do.
Okay.
We keep assuming that we figured it out. We keep assuming that, we've got the answer. And the more that we've made that assumption or acted based on that assumption, the more that we've seen ourselves fall on our face. Okay. So I think we have to at some point recognize COVID is smarter than we are at this point. Ooh. Until we have a vaccine, and that actually, because even the idea that, are there multiple strains to this? Now there was originally this suggestion that, it clearly there aren't multiple strains. And then, but it never made sense that you had some people who would get it and were completely asymptomatic, never had a problem, never had anything. And then you had other people who were seemingly, at death's door within 24, 48 hours. And that doesn't make sense that that's one thing that is affecting people quite in that same way, that extreme. So it's like the fact that we don't know, I think we have to humble ourselves as a nation and as a community to realize that we still don't know what we think we know about COVID that, allows us to act in a way that is cavalier, and that we have all the answers within the control that we have. So when you're in an environment where you don't have that information, then you have to be more cautious about how you're going to handle these particular things, and look to, what can we do that is more, that will keep the safety of what do we know versus not what do we not know. What we know is that wearing masks helps. What we know is that getting people is tested, helps us figure out, what they can do. Making sure that you actually do basic things like wash your hands. I used to call it, or I've called it in other places, serenity prayer science. I mean, just do what you need to do and don't worry about the stuff you don't. But if you take care of what you're supposed to do, then, don't worry about the rest of it. And so that's kind of the way that we have to treat COVID, is we can't keep assuming that we got it figured out, or, the vaccine is coming next, in a couple months. So we just hold on and you'll be fine. We have no idea. And any vaccine that comes that quickly, we have to be really cautious of, because most vaccines take quite a long time to develop and to get to the point where they're safe and when we know the side effects. I mean, to develop something, at lightning speed is a little scary.
Absolutely.
And so, I mean, I'm not an expert in that, but I do know much that things usually take some time and years to get through the process. So expediting it with all the cautions that we have, part of that is going to be really important, to make sure that we are careful about who gets it, how we roll it out, and that it's safe before that actually does more damage than good.
Okay. Dr. Griffith, you've really, I really absolutely have to have you back on the SiteCast with some other folks. I have to hear more about your views on social disparities, men's health in general, and just your way of thinking about it and framing it in a very calm manner. And I thank you so very much for appearing on the SiteCast. And what I would is what Dr. Griffith has kind of put in my mind, because we've been talking about it. If you've noticed, we've run the gambit in terms of talking about things. We have touched on a number of issues, not knowing the answers, but certainly trying to ask questions and share with each other. So there's been a lot of talk with COVID and the term herd immunity. So I would probably, I guess I'll just leave the audience with this when I think about herd immunity. When you actually think about the immune system and what that actually means, what does it mean for your body to be immune? That's just a whole bunch of cells working together. That's it. Some cells that are designed as the immune system working together. And then here's the other component of it. The rest of your body has to be able to tolerate that immune response and get through it. All right. That's all it is. That's, it's more than that. But that's the basic premise of it. All right. So we can wait for herd immunity one way, or we can get it another way. We can get it through these conversations we have with each other. We can get it through making decisions that help us work in a very complex, unknown environment, but in a way in which we start to leverage each other so that we can act in concert. And we can, if you will, support each other while we're dealing with whether it is unemployment, schools being closed, deaths. We have to find each other and tolerate this. And that, to me, when I start to think about a different way of herd immunity that we can do right now, we got to start having these conversations. We got to start talking to each other and start digging into how we are going to address these complex situations. So, Dr. Griffith, sir, thank you so very much. You and your family be safe. It has been a pleasure speaking with you.
Thank you. You too. My pleasure.
And that concludes the interview portion of our show this week. Don't forget, you can find links to further reading by clicking the links in the show notes, wherever notes are found in your app. When we come back, it'll be time for Dr. Renee Kohanski. And welcome back to the SiteCast. I am Nick Andrews. It's time now to welcome back Dr. RK.
Many of our patients are really feeling this continued stress and strain from the COVID restrictions and limitations. And definitely, I am always about confronting what is and what is not, and above all else, reality checking. Paradoxically, perhaps, one of the best things we can offer our patients right now is a message of possibility. This is what we are about, and this is what we have always been about. Finding possibility and solutions where there seemingly appear to be none. Troubleshooting through the crevices of old thought patterns that don't work. There will always be insurmountable problems facing not only our patients, but we as well. Remember, in our not too distant past, our nation survived the life-changing events of 9/11. We survived a revolutionary war, a horrendous civil war, not one, but two world wars. Nazism, McCarthyism, Cold Wars, energy threats, market crashes, and Great Depression, flu pandemics, and polio epidemics. And from the ashes, always are reborn a phoenix of faith, dignity, sanity, and hope. There is a deep sense of right and wrong, and each one of us can respond to the grand purpose of the challenges of this time, both individually and as a nation. We can help our patients find their purpose and face their individual challenges. So to be there for our patients, we must of course take care of ourselves. We have to keep our clarity. We must not be driven into the morass. Do you have doubt? Of course you do. So let me help restore your faith. Look to the rapidity with which we've reached phase 3 on vaccines for the coronavirus and how quickly we are finding solutions. Even controversial solutions are becoming less controversial. Numbers of positive cases may be rising, but lethality is decreasing. And remember, our initial goal was to flatten the curve. We did flatten the curve. Many have lost sight that this was the endpoint. Scarce masks, PPEs, respirators, even access to disinfectants. All of these are fears in the past. Remember that. What other fears do you suppose will soon be in the rear mirror? How many of you are now proficient in telemedicine? How many of you now have new access to your patients who you may previously been unable to see? What benefits are working home affording so many people? What kind of lifestyle changes have been eliminated, including traffic nightmares as well as air pollution abatement? We are a people of ingenuity and creativity, particularly when faced with a difficult problem. Remember Apollo 13? I submit these times are no different. We as psychiatrists need to be a voice of sanity and possibility. I'm Dr. Renee Kohanski for the MD Edge Psychcast.
And that concludes episode 129 of the Psychcast by MD Edge. The Psychcast is produced by MD Edge editors Gina Henderson and Jeff Bauer. All MD Edge podcasts are produced by MD Edge executive editor Kathy Skarbeck and the vice president of editorial at Medscape, Dr. Ivan Aransky. I am your audio engineer, audio editor, and the voice of MD Edge podcasts,